My name is Lexi Nolen. I'm the director of the Center to Eliminate Health Disparities at the University of Texas Medical Branch in Galveston. We understand childhood obesity as one factor related to food security and food insecurity. Food security exists when people have access to sufficient, safe, and nutritious food sufficient to maintain a healthy and active lifestyle. It includes physical and economic access to food. It also is related to food availability within a location, sufficient resources for obtaining that food, and also the use of the food and the preparation, appropriate preparation of food. We understand that this is an issue, this issue of childhood obesity has to be tackled holistically. It is not something that can only be tackled by concerned people getting together at the community level, nor can it only be tackled by health promoting policies. It's really a problem that has become so integrated into so many different systems in our society and by so many pathways that it's going to take a tremendous focus to combine both community bottom-up approaches and individualistic family and social dynamic training and approaches, as well as healthy policies that are operating at local, state, and national level that are creating incentives for production of healthy food systems as a whole, including the agricultural sector, including food distribution, including restaurants that should be encouraged to look at the ways that they're preparing food. And this isn't simply a matter of wanting to have healthy kids. This issue extends into national security. If you think about the fact that the most common reason for people to be turned down from the armed forces is that they aren't in sufficient physical condition. It extends to the crisis that we're having in healthcare in terms of the cost of care that is projected in 20 or 30 years to really be possibly the straw that broke the camel's back in terms of our healthcare system. It could completely bankrupt our system. Obesity, childhood obesity, which leads to adult obesity, is tagged to a whole plethora of chronic conditions and diseases, including things that sometimes people don't think about, such as cancer. And by addressing the issue of obesity at a younger age, we're going to be creating a much more sustainable healthcare system too. And because childhood obesity is largely moderated by diet, and that once children have become obese, they are inclined to have less physical activity, it's really through healthy food that we need to begin this process. Physical activity is critical and important, but the diet is the most important factor for controlling childhood obesity.